Hi, I am Cheryl Kemp, the nurse navigator from DMC Sinai Grace location. We are here today with the Detroit Coffee Lodge in conjunction with San Bernardo Park Association, and we will welcome you to our chat with Doctor. Today, on February 21st, will be Dr. Dawn Foster. She'll be discussing hypertension, diabetes, and preventative care. Remember, this is the last week of the Heart Month, which is February, and we go red for February and Heart Month. Please come out to the Detroit Coffee Lodge, share with us, here's some good information on what the heck I do not know. Health, education, communicating knowledge. Thank you to the San Bernardo Park Association and the Detroit Medical Center, along with Detroit Coffee Lodge.
Okay, so we're going to talk about hypertension, a little bit about diabetes, and then if you have any particular questions that I don't go over, definitely want to ask. So, as you know, hypertension is a disease that can affect the heart and the blood vessels within the body. It is a reflection of the heart putting in extra work to push the blood throughout the body. And so those numbers that you see when you check your blood pressure is the pressure that the heart is using to move the blood. And so most of the time we don't have much in the way of symptoms when we have high blood pressure. But that's why we call it the silent killer, because it can be very high and you don't really know that it's high. But the kind of numbers that we like to see, the top number around 120 or less. The bottom number, in the 60s or 70s would be awesome. When the top number is in the definitely 140 or over, that's considered high enough to start medication. The bottom number, if it's 90 or over, that is also considered high enough to start medication. And so why are we so worried about the blood pressures? It's because years of having high blood pressure causes damage to your blood vessels. Blood vessels are everywhere in your body, and so that's why the complications from high blood pressure can be a lot of different things. It can affect your eyes, decrease your vision. It can affect your heart, obviously, right? And affect the way it pumps and damage the blood vessels around the heart. It can affect the circulation in your legs. It can affect your kidneys and cause the kidneys to fail. So all of that can happen because the blood vessels are damaged when the pressure is high for long periods of time.
Is there any particular amounts of salt due to weight scenarios?
Well, okay, so the salt recommendations are not necessarily related to weight. Weight in and of itself will increase the blood pressure. So we already know that part. And then, but the amount of salt that you're taking in with your food or what you drink, that definitely we want it to be closer to 2 grams per day. Yeah. That is the recommendation for the sodium, the salt.
What are the medications that you would recommend, and then add, you were talking about specific groups of people, African Americans, what better, and then have there been real studies that helps us to trust those medications?
Okay, yeah, so there's multiple classes of medications that we give patients for hypertension. So usually when someone initially develops high blood pressure, we try to give something that's just once a day, and the least amount of side effects, obviously that's possible, but any medication that's given always depends on the situation for that patient. So that's why it's so many different medications.